Hi, I'm Kyran Quinlan from Rush University Children's Hospital in Chicago to tell you about our advocacy case study, our work over the past 15 years to change the way microwave ovens are made to protect young children from severe scalds. This began as a conversation in 2005 with Dr. Larry Gottlieb, medical director of the University of Chicago's Burn and Complex Wound Center. Severe scald injuries are difficult to prevent because they happen in so many different ways. But one way seemed preventable. Many 2 or 3-year-olds are severely burned after opening a microwave oven, removing the heated contents, perhaps soup, and spilling it on their face, chest, and abdomen. Terribly painful, and the scars can change a young child's life forever. We thought that if the oven doors were harder to open, child-resistant, kids would be protected. Dr. Gina Lowell led our 2008 analysis of burn unit data and found this type of scald was pretty common, making up about 1 in 10 of the children admitted for non-tap water burns. Just under half required split-thickness skin grafting. Here's co-author Marla Robinson.
Our 2011 study demonstrated that 15 to 18-month-olds were sometimes able to open microwaves, and by age 2, over 80% could. Microwaves sold in the United States have to meet a published standard administered by Underwriters Laboratories. Change the standard, and you change how microwaves are made. With the help of Dr. Jonathan Midgett from the Consumer Product Safety Commission, we found Joe Musso, the manager of microwave standards at UL. We proposed changing the standard to require 2 simultaneous but dissimilar actions to open the oven door. Even though this type of burn is well known in burn units, microwave manufacturers had never received consumer complaints. On January 31st, 2014, this first attempt failed.
After this defeat, we worked with the children's product safety organization Kids in Danger. Every year, they give senior engineering students a child safety design challenge. In one semester, the students provided a proof of concept by retrofitting a microwave with a child-resistant door mechanism. In 2016, we reported that in the prior decade, U.S. emergency departments had treated over 7,000 children under the age of 5 for microwave-related burns. 2/3 of all these burns involved the child getting the heated food or drink out of the microwave themselves.
In 2017, Joe Musso at UL asked us to join a national task group to keep working on the issue with the microwave manufacturers. We made a video of a young patient story so manufacturers could see the human side of the statistics. Dr. Quinlan and I became official voting members of the group that sets the standard. In early 2018, our task group made a second attempt to change microwaves by requiring 2 distinct actions to open the door. On September 17th, 2018, this passed by a single vote. Child-resistant microwave doors will be required in March of 2023. All microwaves will also have a new warning label.
This experience taught us several child advocacy lessons. First, start with a good idea. We saw a significant problem with a passive prevention strategy. We knew that making microwave doors harder to open really would protect younger children. Second, build a team. We work closely with regulatory agencies and industry to get enough microwave makers to vote for the change. Third, we put a face to our data. Our statistics documented the problem, but the video helped change hearts. And finally, be persistent. This took longer than we expected, but it was so worth it. We are extremely proud that by working cooperatively with industry and regulatory agencies, young children will be protected from severe burns as new microwaves with child-resistant doors replace older models.